Do you know what it feels like to call 911 and hear them say, "We're on our way, but the nearest hospital is over an hour away"? Imagine that happening when your child is unconscious, your father is having a stroke, or your wife is in labor. That's not the future, that's right now. That's America in 2025. In a country known for its medical advancements and wealth, entire communities are being left without a single hospital bed. This is the story of how rural America is being medically abandoned. And if you think it doesn't affect you, if you think it's just some small towns out there, think again. Over 60 million people in the US live in rural areas. That's nearly 1 in 5 Americans, and many of them no longer have a working hospital. Let's start in Texas. In 2023, St. Mark's Hospital, after years of fighting to stay afloat, shut down for good. Not just the ER, not just maternity, everything gone. Hundreds of staff laid off, doors locked. The nearest emergency care over an hour away. And if you're lucky, maybe a little less. But in a heart attack or stroke, even 10 minutes can mean the difference between life and death. Imagine waiting over 60, and St. Mark's isn't some isolated tragedy. It's the beginning of a trend, one that is accelerating in 2025. According to data compiled in early 2025 by the University of North Carolina's Rural Health Research Program, over 190 rural hospitals have closed across the United States since 2010. 17 more shut their doors in just the last 12 months alone, and over 600 more are at risk. That's more than 1/3 of all rural hospitals in the country, gone, or on the verge. Each closure is more than a news headline. It's a community losing its safety net. It's a mother giving birth in the backseat of a car because the delivery wing shut down. It's an elderly man dying of pneumonia at home because the clinic can't afford a doctor anymore. It's a family praying that a helicopter will arrive in time because driving to the city is not an option in the middle of a blizzard. You want to know why this is happening? The short answer is money. The longer answer is insurance. Rural hospitals don't have fewer costs. In fact, they often spend more per patient. They still have to pay nurses, keep the lights on, maintain life-saving equipment, but they serve fewer people and they get reimbursed less. Medicare and Medicaid pay only a fraction of what it costs to treat a patient. Private insurance companies? Sometimes even worse. In 2025, some rural hospitals are being reimbursed just 60 cents for every dollar they spend on patient care. That means if treating a patient costs the hospital $1,000, they're getting back $600. Do the math. That's unsustainable. Now imagine that happening to thousands of patients every year. It's a slow bleed until one day the hospital just can't keep the doors open. Here's another shocker. Medicare Advantage, which now covers more than 50% of all Medicare recipients in the US, is actually making things worse. It's supposed to be a better option, a private plan with more flexibility. But hospitals say these plans often delay payments for months, underpay for care, or reject claims entirely. A regular Medicare reimbursement might arrive in 2 weeks. Medicare Advantage, try 60 days or 90 or never. And small hospitals can't wait that long. They need cash flow to survive. Take a look at how it plays out. A hospital in rural Nebraska recently reported losing over $8 million in reimbursements in just 3 months due to delayed insurance payments. In Alabama, a hospital had to close its chemotherapy wing after its contract negotiations with insurers broke down. In Mississippi, 5 counties now have no hospital at all, 0. If someone crashes their car on a country road in one of those places, the chances of survival drop drastically. Not because of the injury, but because of the geography. They simply can't get to help in time. And when hospitals close, it's not just medical care that disappears. They're often the largest employer in town. A rural hospital shutting down means hundreds of people lose their jobs. Nurses, janitors, cafeteria workers, doctors, lab techs. The local pharmacy closes. The diner across the street empties out. The economy dies alongside the emergency room. In 2025, this isn't just a healthcare issue. It's a collapse of rural infrastructure, and it's only accelerating. In a report released in March 2025 by the National Rural Health Association, nearly 48% of rural hospitals are now operating at a financial loss, almost half. With inflation, rising drug prices, and higher labor costs, that number is expected to grow past 55% by the end of the year. We are witnessing a system crumble in real time. Labor and delivery units are usually the first to go. Since 2011, over 200 rural hospitals have closed their OB units. That means thousands of women are now forced to drive hours just to deliver a baby. In emergencies, there's no time for that. In 2024 alone, over 5.6 million women in the US were living in what's now called a maternity care desert. By 2025, that number is closer to 6 million. We're going backward. And it's not just birth. Cancer treatment, chemotherapy, is also vanishing. Between 2014 and 2022, nearly 50% of rural hospitals in Texas alone stopped offering chemo. That's thousands of cancer patients who now have to travel hours, multiple times a week, just to get life-saving care. Many give up. Others die waiting. When people say healthcare desert, they're not being dramatic. It's real. A healthcare desert is a place with no ER, no OB, no cancer care, no mental health services, no hope. In parts of rural Ohio, Montana, West Virginia, and Georgia, entire counties now fall into this category. That's not just neglect, that's abandonment. So, what's being done? For decades, the government has tried to help. Some hospitals are labeled as critical access hospitals, which allows them to be reimbursed at 101% of their Medicare costs. That's a start. But it only applies if the hospital meets strict criteria. Some are too big, some are too close to another facility, even if that facility is 40 miles away. Bureaucracy doesn't understand distance when there are no highways. Another option, the Rural Emergency Hospital Program, launched in 2021. It gives a hospital a multi-million-dollar grant every year, but only if they eliminate all inpatient services. In other words, you can only get help if you shut down beds. Think about that. A program meant to save hospitals by forcing them to stop admitting patients overnight. That's like saving a drowning man by taking away his oxygen. And what about new ideas? That's the thing, there aren't many. Most policy changes are band-aids, short-term funding, pilot programs. Meanwhile, the root problem remains. Rural hospitals are being underpaid, period. Insurance companies, especially private ones, have enormous negotiating power. Hospitals don't. If they try to push back, insurers walk away. No contract, no payments, no hospital. In 2025, the US government continues to send billions to urban health systems, research institutions, and high-tech innovations. And yet, a hospital in rural Iowa has to launch a GoFundMe to keep its ER open. That's not a healthcare system, that's a crisis. The human cost is staggering. In rural parts of America, the mortality rate from preventable conditions is now 60% higher than in urban areas. Infant mortality is up. Stroke deaths are up. Suicide rates are climbing, especially among farmers and low-income rural workers who can't access mental health care. This isn't an invisible problem, it's happening every day in the open. And no one's listening. Ask yourself, what would happen if every hospital in Los Angeles closed? What if every ER in New York City went dark overnight? Would we allow that? Would we call that acceptable? Of course not. But when it happens in rural Arkansas or Montana, we shrug. We say, well, that's just how it is out there. But these towns matter. These lives matter. And they're being lost. You can see the desperation in the eyes of every paramedic who knows their patient might not make it. You can hear it in the voices of doctors who now drive 3 hours to work because they're the last specialist left in the region. You can feel it in the silence of a hospital corridor where the lights are still on, but the rooms are empty because no one can afford to keep the doors open. This is not a red state or blue state problem. This is a national disgrace. Rural America fed this country, it fuels this country, it raises children, grows food, and keeps communities alive. And right now, it's being allowed to die. Quietly, painfully, without dignity. The fix isn't complicated. Pay rural hospitals enough to survive. Stop underpaying for care that costs the same or more than in big cities. Reform insurance reimbursements, fund local health infrastructure, empower local solutions, not just federal rules, because if we don't act now, there won't be anything left to save. America is failing its rural hospitals. And with every closure, we fail the people who built this country, who sustain it, and who still believe in it. But if we truly care, if we're willing to see them, hear them, and fight for them, we can still turn this around. But the clock is ticking, and the ambulances are already too far away.